Good afternoon, everybody. It's Dr. Galvin with your daily update on the coronavirus pandemic and the current situation. Not a lot has changed on the ground since yesterday. I think we've got more and more cases being reported, and we've got more and more states implementing much more severe restrictions. New York and California have essentially gone to shelter in place, which means you stay home and only essential people really are allowed to get out and do work. We had over 14,000 cases in the US reported as of today, 217 deaths. That means about 1.5% mortality rate for this infection. Better than some of the earlier projections of 3 or 3.5%, although numbers are early. We're going to have increasing numbers very quickly in the next few days and next few weeks. The more testing we do, the more cases we find. We'll probably pass Germany in terms of number of cases tomorrow, and we'll pass Spain and Iran, sometime over the weekend. So the cases are markedly increasing. I think one of the things we need to talk about is the CDC data from both the US and the data from France that shows about half of the critically ill patients, the ones that require this high level of care, ICU and everything else, are less than 55, which is unusual. We thought that it would really affect a much older population. So these spring breakers that are out there partying and spreading the virus to each other have got to really sit back and start thinking about everyone else in this country, and they need to back off, and they can party next year, but they've got to stop this year. We've got to get people taking this very, very seriously, or otherwise we're not going to be able to stop the spread of this, and it's really going to become even more catastrophic than it already is. I think that one of the questions I get tons of questions about children. And so far the data has been fairly consistent that children generally are at low risk of getting any kind of severe disease. The majority of kids that get it have mild symptoms and recover with no difficulty. A fair number of those kids are being tested and are actually having no symptoms at all and are testing positive. So kids can have asymptomatic infection, but they can still give it to their parents and their siblings and their grandparents and their loved ones. So when we talk about social distancing, is it okay to let your kids go out and play in the playground with other kids? I'd probably say no, because the fact is that they could get exposed to another kid that's got it. They can get exposed, they can start shedding virus, maybe have no symptoms at all, or maybe just a little sniffle. And then if you've got someone who's at risk, someone who's older, who has underlying medical problems, then they can get it and can become very, very ill. So we've got to do our best to distance our children from each other, as hard as that is. I remember having young children, and the thought of having them cooped up for weeks at a time in the house probably would have led to a mental breakdown and a long stay in a psychiatric hospital for me personally. One of the questions I get about children all the time is, what about asthma? Are they at higher risk if they've got asthma? I don't think we've got great data to show that they're a much higher risk if they've got asthma, but there is an important fact about asthma that we've got to be aware of. Many children use a nebulizer machine for their treatments, and unfortunately, a nebulizer machine aerosolizes the medicine so that it can be breathed in. And if you've ever given a kid an aerosolized treatment, you'll see all this steam that kind of comes out of it. Well, unfortunately, that nebulizer can also aerosolize the virus. And so if you give a kid who's got it a nebulizer treatment, then it can contaminate the entire room. And so if you've got kids who are using nebulizer treatments, you may want to speak with your pediatrician and see if they can be switched to either oral albuterol or an inhaler instead, because both of those are going to be much less risk for spreading the virus. I think that as things progress, we'll get more and more information, but I want to reassure parents their kids are probably at pretty low risk compared to the rest of us. I'll be working in the emergency department at the end of this weekend, either Sunday or Monday night, I believe, and so I'll give you some more live updates in terms of that. In the meantime, recommendations haven't changed. They've tightened up a bit. Wash your hands, take care of yourselves, take care of your families, take care of those around you. We're going to get through this. Don't panic. And I'll be back tomorrow with another update.